Okay, good afternoon, everybody. I think that we will start just on time. So I saw some familiar faces, a new one. Welcome. I have to speak louder. Yeah. And we don't have a microphone.
No, this is the overall microphone. Just
okay. Yes, I will try to speak louder.
And maybe we can close also the
you can
avoid some noise, background noise. And you also can come. Yes, since we are just
and it is so cold that
we will warm each other.
Okay, so welcome to our Imaging Working Party. Okay. Here thank you, Silvia. Here our agenda. So I will tell you quickly about the chair, the secretary, and the leads of the three pillars. We will have an update on the clinical care pillar, the training and education pillar, and the science and research pillar. And then we will talk about the working party participants with the new application of the new members and even the involvement of the eMERGE, the allied health professional, and the ENCA. And of course, the discussion is open. Thank you. So here our core group. I'd like to thank Silvia Magni Manzoni. I think that everybody knows her. She did a huge work as a chair of our working group and so many studies on imaging and ultrasound. And she is still the lead of the science and research pillar. I'd like to thank Clara, she's just arriving, and Jelena from Serbia, who are still our mentor, very active in our group. Daniel Winchell is the chair, but unfortunately he couldn't be there today. And he is the lead of the training and education pillar, and myself, as the secretary and lead of the clinical and care pillar. So let's move to the training and education. As you imagine, the purpose is to improve imaging, especially ultrasound in pediatric rheumatology. So we started in June 2022, the Imaging in Focus, in a format of a webinar of 1 or 2 hours. We had 3 webinars since June 2022, with for each webinar 3 clinical cases with very interesting images for the discussion, and for each webinar 30 to 40 participants, so it was quite a success. So the purpose is, of course, open to everyone. So if you are part of the working party and you want to discuss even not very strange or difficult cases, but if you want to share some images, some clinical case, if you have any doubt, so don't hesitate. We will soon have new dates from autumn, and of course, I will send you the agenda for this year.
Indeed, this initiative started from an insight that came from one of the working parties we had from an Indian colleagues that would like to share her own images and propose them to discuss, because it's quite common that there are several people that are practicing ultrasound, but dealing with other imaging techniques, and they feel they are alone. So they perceive the need to share images and to have a discussion together with other people. So that's why we started with this Imaging in Focus. Of course, we propose different cases, but it's not mandatory to have difficult cases. It's just an opportunity to share and to understand better what we are doing on our own daily work. So feel free to
I see that there are, and I think that there is an attendance sheet, so please sign and check your contact details and your email. Okay, so if you are not already in the group,
is round in there, but then several people came in, probably just check if you are already signed in the mailing list, and if you are not, please feel free to add your name and your email address and so on. Okay.
So our group will participate to the new webinars of the PReS. The PReS Education and Training Committee is planning online webinars, including all 10, I think, 10,
about 10 to 11 working parties.
Working parties. So each month, the third Tuesday of each month from 2 to 3 p.m., sorry, I hope that you will be able to participate. So the first one, it will be those that on vaccination in October 17. So the purpose of these webinars is to review knowledge in pediatric rheumatology from medium to advanced level. So it aimed at trainees and at pediatric rheumatologists who already have some experience. And we, as a group, we will have a focus on the current status of ultrasound of enthesitis in children. I will do the talk. And Daniel will share about the CACP ultrasound criteria and differences to JAA. But we do not have still the data, so I will share the agenda. Moving forward about the training and education, we had a great course. I don't know if someone was there. It was the basic course of in Prague of 2022 with the 40 participants from 30 different countries. And this year, we just finished yesterday the intermediate ultrasound course with 30 participants. It was very, I hope that it was a great course, but we already have some feedback, quite positive, I would say. And so according to the EULAR and PReS content, format, and conduct for the ultrasound courses, the learning objectives, it was to just remind the principles and application of musculoskeletal ultrasound in children, to make an update on the standardized ultrasound assessment and the different scoring system per joint. And we have a focus on Doppler and especially in pathology, because it was the main purpose of the course, to identify pathological ultrasound findings in children. So we have a 50% theoretical and practical part. 30 participants, no, I think that it was quite a success for an intermediate course in pediatrics. And you can see from 17 countries, so it was amazing, from Switzerland to Taiwan. So thank you for the participation. You can see the faculty on the left and the tutors on the right. And I'd like to thank, he's not here today, Merlin, because he helped us so much in the organization, and especially for the participation of patients and family. Our group also participated this year to the Knowledge Basic Exam project. I think that it is ongoing right now. So it is the first test of knowledge in pediatric rheumatology. The aim is to measure the knowledge that should have been achieved at the end of the training in pediatric rheumatology. So this test is open to pediatricians who are doing a training program in our field, but also to pediatric rheumatologists who would like to confirm their knowledge. So our group participated, and I'd like to thank Perrine Dussert, my colleague from France, and Ralph Trauzeddel. I hope that I pronounce well. I don't know if you, because I know. Ah, okay. Osra, yes, sure, Osra. She did a great work. And Perrine and Ralph just joined our group later on, and they helped us because we had to provide 100 questions. It was very hard as work because the purpose is to have the best answer out of 4. So I think that you can imagine it was a huge, huge work, but we did it. Here are the ongoing activities in science and research. So Silvia, as I said, is still the lead of the science and research, and she coordinated a study, very important. It was the first publication on behalf of the PReS Imaging Working Group on the procedures for the content, conduct, and format of Euler PReS pediatric musculoskeletal ultrasound courses. So we based our course in these procedures. And Daniel Winchell just finished a study on the validation of a normal age and sex-related sonography findings of the knee and the hip by comparison to JI patients who have this kind of involvement. And the publication is already prepared, and I hope that the study will be published soon. Here, the new collaborative, you can't interrupt me if you have any question, don't hesitate. So the new collaborative projects, we would like to start a project at Delphi in the consensual definition of enthesitis with Viviana Ravagnani. There is a project on CACP by Daniel, and an emerge project. I don't know if the Turkish group, there is someone here. Okay. You will present the study. So the first step for the consensual definition of ultrasound enthesitis, it was the systematic literature review. We just found 5 articles in the field, but it was the necessary step before moving on. And the next step will be the recruitment of expert participants. We already have 19 participants from the Omarat Ultrasound Pediatric Group, and we are recruited, so you are invited if you are the prerequisite for participant from the PReS Ultrasound Working Group. So the prerequisites are the intermediate ultrasound course, Euler PReS, 5 years of experience, because it's quite hard to examine enthesis in children, and sure, a daily practice of ultrasonography focused on enthesitis. And the next step will be a 2-step Delphi process, with first the development of definitions for enthesitis and then the validation by testing their applicability on ultrasound images. The CACP project by Daniel, the literature review has already been done. On ultrasound findings, there are no many studies on this subject. The next step will be the work on still images with an online surveys for defining the ultrasonography criteria of CACP. And the final step in the live exercise, because they have 3 patients in German. So if you want, I can invite the Turkish group for present the study. I just have to say that usually our procedure, according to our procedure, we should evaluate first the project and validate it before proposing to other groups. So you can present and we can discuss just after if you want. Don't be scared. I have the slides because Daniel sent me the slide. Yes. I don't know if you change something or not. Because Daniel, I think yes, you can present, but I already have the slides.
Yes.
Okay. If you don't, no problem. Okay.
Some change. Hello, everybody. My name is Şeyma Türkmen. We are working as fellows at Ümraniye Research and Training and Research Hospital in Istanbul, and we will share our study now. Our study's title is Ultrasonographic Evaluation of enthesis in the enthesitis-related arthritis and juvenile psoriatic arthritis. We will investigate in our study this question's response. Are the frequency and distribution of tenosynovitis and or enthesitis, its relationship with disease activity and treatment responses different in enthesitis-related arthritis and juvenile psoriatic arthritis. Background and objective. A limited number of studies have reported on the ultrasonographic evaluation of enthesitis findings in ERA and JPSA, utilizing real-life data from a pediatric rheumatology perspective. More reliable evidence is still needed regarding of the ultrasonographic assessment for diagnosis, treatment, and disease activity evaluation, ERA and JPSA. The aim of this project is to assess the value of ultrasound guided enthesis evaluation in the diagnosis and treatment of ERA and JPSA, comparing imaging and clinical findings, as well as evaluating disease activity and treatment responses using obtained results. Additionally, we sought to contribute towards establishing normative data based on age groups and fostering international consensus regarding ultrasound-based enthesis evaluation in pediatric patients. This study will be conducted at University of Health Science Ümraniye Training and Research Hospital, Istanbul, Turkey. After obtaining approval from Ethics Committee, informed written consent will be received from patients and parents of appropriate. Patients under the age of 18 who were diagnosed with ERA and JPSA and continue to be follow-up, satisfying the criteria of ELAR. We will investigate between two groups demographics and clinical data such as age, sex, body mass index, family history, comorbidities, age at disease onset, duration of disease, clinical features at onset and complication during the course of disease, activity of disease measured by juvenile spondyloarthropathy disease activity index, JSPADA, and CRP, ESR, ANA, HLA-B22 applied treatment, of course. Enthesis areas to be examined by ultrasonography and clinical examination. We will investigate, we will evaluate these areas: proximal plantar aponeurosis, distal Achilles tendon, distal and proximal patellar tendon insertion, distal quadriceps tendon, and distal triceps tendon. And our study process, of course, obtain ethical approvals, recruit participants from target age groups, and we will evaluate these patients four times in a year, 0, 3, 6, and 12 months. Gather clinical data, relevant information. We want to presentation share with you this our study. Process and analyze collected data, calculate normative values based on age groups, and I changed this my original slide. This slide some a bit, and finally compare clinical findings with ultrasound results in our study, and we will prepare research paper and publication, finally, our study. And data of clinical characteristics, demographics, imaging results, treatments, and outcomes will be collected prospectively and compared from the records on the Excel by SPSS program. Identification of the cases, diagnosis of ERA and JPSA was based on ELAR criteria, and collecting the, analyzing the data I and my friend Kadir Ulu from Turkey, it's planned to create and publish at least a scientific article with the outputs obtained at the end of the study. And article will be written my friend Kadir Ulu and under the supervision our mentor is of Professor Dr. Betül Sözeri from Turkey. Primary study coordinator is Department of Pediatric Rheumatology of Ümraniye Training and Research Hospital, University of Health Science, Istanbul, Turkey. Of course, in our study, participation in the study is free. Biological material transfer will not be made within the scope of the study. Study will be compliant with the Helsinki Declaration. Centers have the right to withdraw their data if they wish at any stage of the study. Thank you. We will send our study protocol if we will prepare. We will work with you. Thank you.
Questions about this communication?
I have a question. Yes.
Me too.
Because you know the problem is, it is the reason why we decided to go further with the definition of enthesitis in children. That is that we lack definition of enthesitis in children. So nowadays we still use the definition of enthesitis that has been established for adult patients. And so what do you have planned to use as the definition of adult enthesitis? Or
Yeah, we will group this, we will define this ELAR criteria, 2 groups.
okay, for the clinical part.
Yes.
But when you want to perform the ultrasound, you need a definition for,
yes,
you know, to be reliable.
we will explain in our I can't explain.
No, take your time.
In our study protocol.
The problem, in my opinion, is that I think that it is quite premature to start this kind of study, even if we need this kind of study. So I think that we are all agreed that it's important to make further studies. But the problem is that we don't know exactly how to define enthesitis in children. We have some data, as you know, in enthesis in healthy children, but we don't have data on enthesitis. So
yes.
Can I add something? I think I know that surgery I worked a long time with together. She has a huge number of patient and health controls. I think she had the normal bodies of enthesis thicknesses for Turkish children according to age and sex.
okay.
Maybe she can compare with this. This is my suggestion.
Okay, but you know, the thickness is just one of the parameters. So
Yeah, maybe.
But is she going to publish that? Because we need, of course,
Yeah,
definitely.
she will be here about some illness she couldn't come, but I guess she has this data and she is writing. I don't know. Maybe she can compare with this.
But anyway, from methodological point of view, first of all, definition.
Yeah, of course.
Louder that.
So first of all, you need consensus on the definition to be used.
Yeah, of course.
Yes.
So that is the first process before you go to all these efforts. So probably you can do
because you can join our group, sure, if you have the prerequisites. I'm sorry, but I think that it's very important because ultrasound of enthesis is really, really tricky. So we need the people with some experience in the field. How many ultrasonographers there are in our
we use musculoskeletal ultrasonography, our daily practice.
Okay.
Usually often.
And another step, because I think that it's important to share
Yeah.
for some suggestion for you, it's that you need a reliability.
Mhm.
You need to evaluate your reliability
Yeah.
between ultrasonographers before starting the studies.
Yes.
So
My
it
opinion,
will
it
you
will be-
operators, and also if other centers are interested in, we need to test our reliability.
Because we have a lot of studies on the reliability of synovitis,
Mhm.
but we also have definitions, so it's more simple.
Yes.
If you lack definition, I think that it could be
I will
difficult
discuss
to
my mentor.
okay.
Yes.
Well, I think it's
I-
really
I
an
will
interesting
say-
point, and maybe
Yes.
just discuss some methodological requirements, because this is a very interesting topic. We are very interested in this, and this is why we already started doing something.
Yes, I
And
will.
of course, we need normative data on that population, so it would be nice if
Yeah, sure.
in the meanwhile that the project is improved and better finalized, we have those data. And also maybe we can go on the other side on the definitions that I don't know if
Yes,
you are willing to use the definitions we are working on, or you are willing to use the definitions provided by the adults. But this is one of the other issue to address to really
Yes,
start.
I will tell her.
So thank you very much for your presentation, for sharing with us your idea, your proposal.
Thank
Thank
you.
you.
Then Dragana, I think she's here with us for share an update about the DAISY project.
You're very Dragana.
Yeah. We want the chair.
Yeah.
Okay, good afternoon to everyone. I will just do shortly introduction with our DAISY project, named Applicability of Standardized Ultrasound Scanning to Estimate Disease Activity in Combination with YADAS and Inflammation Markers in GA patients. And I will just remind you on the study protocol and what we did until now. Our international multicentric study has gathered 11 participating centers from 10 different countries. Two main coordinating centers are in Niš, in Serbia, with Professor Jelena Vojnović as a home center mentor, and in Italy, Genoa, with Dr. Clara Malatia as a host center mentor. And of course, we have a great help of Printo staff and Dr. Nicolino Ruperto. The main goal of our project was to enable a more sensitive disease outcome tool, which will combine musculoskeletal ultrasound, disease activity assessment by YADAS 10 and 27, and also with serum biomarkers in order to achieve optimized, personalized, individualized treatment of our GA patients. We aim to enroll 150 patients, 30 with oligo and 120 with polyarticular disease course, only in eligible sites, meaning that each site must have at least one certified pediatric rheumatologist and at least one pediatric ultrasound expert. Of course, ethics committee approvals must be obtained and our patients must be willing to be enrolled. And all of them must fulfill inclusion criteria prior to project startup. That meaning that all of them must meet ILR classification criteria for GA oligo or polyarticular disease course. All of them must fulfill criteria for the treatment escalation, and all of them must have active disease according to clinical disease activity parameters, YADAS 10 and 27. At baseline and already predefined visit after 3, 6, and 12 months, all patients must be simultaneously followed for the clinical disease activity assessing by certified pediatric rheumatologists and calculate TIADAS 10 and 27. All of them must be scanned by an expert in pediatric musculoskeletal ultrasound. We scan all 44 joints in powered Doppler and grayscale scale using Omerak's innovative scoring system. And what is important that certified pediatric rheumatologists and pediatric ultrasound experts are blinded for the examination of each other. And at the same time, at each visit, blood samples will be collected to assess inflammatory serum biomarkers. One of them will be performed locally, ECR and CRP, and the other ones like cytokines, chemokines, and S-hydroxylase proteins will be stored locally until shipped to the central lab. In case of this disease worsening, unscheduled visit will be performed. Of course, first we had to receive ethics committee approvals for each participating centers. All of them must send the joint accessor certificate issued by Printo and as a proof, send us cellular ultrasound certificate. After that, we did activation of the participating centers, meaning that after that, our ultrasonographers could access the study DAISY web portal, where they can reach material for ultrasonographers with instructions for ultrasonographers, with educational material with standardized ultrasound joint scanning in 4 different age categories in children, and pathological pediatric musculoskeletal atlases with different grayscale and powered Doppler scoring example. After they revise this educational material, then they must perform tests for ultrasonographers, which represent calibration well-based reliability exercise on still images presenting different grades of synovitis in order to optimize interventor reliability. Up to now, we did activation of 10 participating centers, 9 centers enrolled patients. We're still getting ethics committee approval from Rome. And until now, we have 92 enrolled patients with leading home center, Serbia, then Turkey, Genoa, France, Lithuania, and we are still waiting for the others to enroll more patients because we faced a lot of difficulty during the COVID epidemiological situation, so we are in a little bit delay. So with your help, we hope that we will finalize our project. Thank you very much.
Are there any questions for Dragana?
Dragana, we can include until, do you have
end of the year, but maybe we must ask for the 2023, yes, because we're in very serious delay, but maybe we can ask for extension just for the patient enrollments in order to, how to say, get our target of 150 patients.
Yeah, no, but now there has been like an update of the protocol and we have to scan 10
we
joints,
have to scan all joints, but to record only 10, which are, how to say, easier, yes, and faster, and only 1 who are pathological. That's it.
Yeah.
So we make it a little bit faster because it was really time consuming.
Faster.
So,
Yeah.
we broke enrollment period at least twice or 3 times until now, and we already asked for the extension. So hopefully we can get 1 more. But best way would be to increase enrollment. The main problem was it's a time consuming for the ultrasound. So that is why we made the modification of number. So it should be that scanning can be together with the imaging taking. It can be done in 1 hour.
1 hour, I would say, yeah.
Yes, yes.
It's much more easier.
And faster.
But maybe what we can do is, anyway, we will ask for an extension, but if there is some additional centers who are interested to get themselves involved and apply for ethical approval, maybe we can increase the number of centers. So that's one of the solutions. Unfortunately, Germany was having some trouble, so hopefully he will increase. Italy, Stefano, Sylvia faced the problems with the ethical committee, so I'm trying to push this boss in the committee. Obviously, what is there an option? The option is that the biobanking, the sampling is, you in regular daily practice, on each 3 months, you visit your patients an overview, and you have to take blood for ECR and CRP anyway. So taking 1 or 2 milliliters more, it's, from the ethical point of view, no problem. So maybe that's the solution for you while waiting for the paper. And Stefano, I don't know, busy. Clara is again busy. Clara, you're here.
Yeah, but Rizana and Albolo, she's great and she's trying to listen on the patient that we are taking.
Yeah. Great.
I have an additional question for the protocol because, well, protocol was planned several years ago.
Yes, of course.
So one of the requisites for the participant was for ultrasonographers, they had to have a dual ultrasound
Certificate, yes, and must be experienced
at
at least.
time, we have not
Have
our-
these courses,
yeah,
yes,
our
yes,
courses.
yes.
So how is, because other people may be interested in participating.
Yes,
and
but
so
we state that they must be experienced in the field of pediatric musculoskeletal ultrasound.
so which certificate should be provided for, just to ask for?
Yes, yes,
included?
yes, of course.
Which kind?
It was when it comes to,
It was really
it was a basic course because in the past there was PReS courses only.
yes.
But now, since we had a course in
Intermediate.
Prague last year, which is ours, there is no PReS anymore. So yes, those who have a
Press.
basic PReS course last year, or especially those who have entered the intermediate course this year, are eligible to apply. Additionally, they will go through the process of
Testing.
the justification anyway, because by the protocol they will be sent several images to score, to check reliability. So this is part of the protocol. So if anybody here is eligible as a center, they can apply. From Turkey, we have. Is it the same center or the other one?
It's a battle
It's a
Sozeri
battle,
transfer,
yeah.
yes, for Istanbul.
Because they are very efficient.
I just add a comment. I think that it was very useful to improve our skill.
Yes, I
Because
agree.
yes, we are obliged to scan all the joints, all the tendons, so it's time consuming, but it was very useful, I would say.
Yeah,
for-
tendons are
for
tend to be
improving.
more
It helps improve.
Or you, Clara.
Well, we decided to include that.
So from methodological point of view, several methodologies participate in the study design, so okay. But the question is how to improve enrollment as soon as possible. That's a very.
This may be another like insight for the Turkish proposal for methodological point of view.
And from Greece, who is from Greece? Is there
Maria
anyone from
Tsims.
Greece here?
She's not here.
And
I don't see.
Sami.
Yes, you're not participating.
Okay,
Okay,
thank you very much,
thank you.
Dragana. Or if anybody has additional questions, may directly contact Dragana per email. Okay.
Yes, you have the email.
Maybe Gaga.
Maybe.
So last year in 2022, we had 76 participants to the working party, to the Imagine Working Party. So I hope that there will be more participants with the application of new members. You know, we thought about to distinguish between participants that just follow the working party activities, who could provide suggestions but cannot or prefer not to actively participate to the working party activities, and then the active members who are really participating in an active manner to the working party and the different activities, and who needs the PReS membership as a mandatory prerequisite. So I think that we have to do this work with Sylvia and my colleagues to define active members. So I think that I will send you the sheet, the survey for, yes, for define who will be more involved as active members. We also have for emerge people. We have Osra just over there. So thank you again for participating to the PReS Knowledge Basic project. And one allied health professional, I don't know if he's here. No,
No, they have kickoff meeting.
Yeah, sure, in parallel. Okay, so it was not possible, but we do not have yet Anka. So I think, yes, great, the first one. Hi, do you want to say something?
Well, I'm from Enka, Sean Liddewever from Holland. And I'm joining your working party.
Ah, welcome.
Imaging, so I'm looking forward to get
Okay.
into detail and help actively. So
Thank you very much for being here. We need your support because, of course, we started from the ultrasound view, which of course have an immediate application to patients, families, and also their understanding and their participating in the management of diseases. So
need another point of view, of course.
yes, and it's really important for us to have you in
Glad to
our
be
group, and I'm happy that you could attend also the other presentation, and please feel free to provide us all your.
I've filled in the list with my mail and
Thank you.
so you can find me now.
Thank
Did you sign the attendance? Okay, perfect.
I am also a card. I will give it to you.
Your role is really important for any of the studies going on.
Sure.
It is preferable from the methodological point of view.
Yes.
And maybe it's idea for you. We use some of those sheets for patients, meaning the satisfaction of patients during especially the ultrasound exam, meaning how comfortable or uncomfortable it is. Is there any pain or discomfort or whatever they be? So maybe we can, they're gonna send the one you used previously for the live exercises. So you can introduce your you or other patients and then send back feedback. So each of these studies should actually use the patient perspective of the participation, because patients as research partners are must do.
Yeah, sure.
So it's very important.
I know. But glad you know also. So
And do you know anyone else who could be interested?
from the
in-
Enka or
Yes, from Enka.
well, we have a small board yet, but we are searching for people.
Okay.
So not at this moment. It's just me for now. So
Yes,
Okay.
but it's because we have just temporary participations to our working parties.
Yes.
Because you were.
I was not a well,
But
I was 1 year and a half now, 2 years now. So, but I have also a sick child, so I had
Yeah.
to
Yeah.
make time to do something. Like
Okay,
this.
so
Now-
we will be in touch with you.
Yeah.
Sure.
Okay. Well.
Thank you very much. And by the way, if we have the mailing list going around, I don't know if anybody else has to sign it yet. Please
Circulate, yes.
please circulate and write your. Check if you are already in a mailing list. If the email is correct, unfortunately, is like.
No, it's better for all of them to write. Yeah.
It's quite small.
Yes, I was answering to the participants online. And yes, I think that we have to add their name
Yes, of
Yes.
course. And just
Yes, could you please, do you have any questions, suggestion for people who are online? Stefano, hi, how are you? Stefano was one of the participants.
the tutor.
Yes, one of the tutors and faculties of our ultrasound course. Please, could you write your name, first name, last name, and your email in the chat? I'm not sure, but I think that. Can you hear me? No, Stefano, we can't.
Unmute, maybe he should.
That's right. Sorry.
Yeah, check the.
No, but I think that
Speakers on
our microphone is open,
but speakers on the laptop, maybe you should.
Yes.
The volume.
That's why.
no, but before they told me that
No,
they
no.
can hear. No.
Hi, can you hear me?
Hi, Stefano.
Okay.
Hi, how are you?
Hi. I'm fine now. I'm fine now.
Okay, okay, thank you. Do you have any comments, suggestions?
I heard Jelena, but I couldn't understand very well because maybe she was far. What he said about Daisy.
Okay,
Okay.
Yes.
so I'll come closer for you.
you are concerned, I think.
We were talking to you,
Perhaps.
This is the mic.
Can you hear, Stefano?
Yeah.
mentioning you because there is only one patient from your center recruited.
Two patients.
Two, sorry, that was two. Any option to make it 4 or 6?
Not shortly, to be honest. It depends. Are you thinking to extend further the time of enrollment?
If you remember a year ago when we had a course in Prague and
Yes, I remember
same,
very well.
working party, we already asked for an extension.
Yeah, I know.
So we are just pending 1 year extension
Yeah, I know very well.
and nothing has changed. So you're excused because you're not well at the moment, but hopefully from Monday you will be better.
So since time has passed, we are close to.
Just stay with us a few minutes, the time that I write your name for people who are
Or they can also
online.
send you maybe an email, which is better.
Okay, yes.
Those who are participating, because we are just have to leave the room because of the next activities, and maybe other people are going to other working parties or other meetings. And so maybe people that are now participating through Zoom may send an email to Linda. We should have already provided some of the emails. I don't know if there is the last slide.
No, I don't think so.
Okay.
Let's write it down.
Yeah.
Yes, I wrote my email, but just for, yes, for everybody,
Okay, so
the last one.
that's the last one. You
No.
wrote not? No?
I can write in the last one. I think that it was the last slide, actually. In live.
Yeah. But you are not
Get out from the booth.
They had my email.
yeah, but we are not rejecting it.
Ah,
It's okay.
sorry.
Just
Escape.
that's right, and then
Stop share.
Stop share, and then share it again. Stop share, and then
Share screen. Can you see it?
I can break on.
No, why?
Escape to get out of the presentation.
We already did it. We already did it. I don't know why.
I have
Uh,
something with
Get out
presentation.
HDMI and back.
Everything is out. So that's
I
why.
don't know why.
The HDMI, this is the connection to the projection. Get it in front and then in, so it will refresh. Okay.
Or I can write as in the ancient time.
You're still sharing?
I don't know because it says you are sharing screen.
No, but this one.
It's real. I don't know why. In any case, I will send you an email with my email. So
Yeah.
yes.
Yes, of course, we will send
So,
an update. of the
Everybody
working party.
sign? No.
No?
Ah, okay.
And of course, if you are aware of other colleagues that are interested in to participate but could not attend for any reason because they were not here, they are in another meeting and so on, please feel free to sign. Indicate the last name, first name and email address. So we can stay, I think, a little bit, but of course, we are very happy to have you here at this meeting. We wish you enjoy the main congress and keep in touch. Thank you very much for having us here.
Thank you. Thank you very much. Just wait, you didn't get. Okay.
Hi.